welcome to Comcast Newsmakers. I'm Elena Russo. Networking means more than just engaging in business relationships. Today, it means healthcare efficiency. Please welcome Dr. Jan Lee, who is the Executive Director for the Delaware Health Information Network. Dr. Lee, thank you for coming in today.
My pleasure. Thank you for having me.
Now, the network, just for the next few minutes, we'll be referring to as DHIN, the Delaware Information Health Network. Tell us what that is all about.
DHIN began as an operational health information exchange 5 years ago, May 2007. 3 hospitals in Delaware and one of the national labs came together with a lot of help from the state, from the legislature, from the governor's office at that time, and agreed that if they would make the data that they have about patients available in a community health record, it would enhance care for patients who cross those boundaries of care, go from one hospital to another, go from their physician's office to the hospital. And if that information about the patient could be visible no matter where they present for care, it would represent a value for the citizens of Delaware and would also lead to reduced costs by reducing duplication of tests over time. Since DHIN began in 2007, we have added additional hospitals, we've added additional laboratories, and it's now a very vibrant, thriving health information exchange. DHIN was the first operational clinical health information network in the nation, and we continue to be viewed as a national leader, with other states seeking our advice and input on how do you do what Delaware has done.
Well, congratulations, first of all.
Thank you.
And talking a little bit more about what the network is, it sounds to me like sort of a database of information that could be very helpful to doctors, whether you are unfortunate enough to get an ambulance ride to the emergency department or you're in for the hospital for your routine exams. It sounds like it really is being more efficient for healthcare.
Absolutely. You know, think about the patient who presents in the emergency department. Perhaps they've been in an accident. There may be any number of reasons why the patient is not really in a condition to be able to answer questions about their past medical history. And yet knowing what medications they're on, what allergies they may have, what recent lab work they may have had, what medical conditions they have is critically important for those who will be providing care for them under emergency conditions. Sometimes you're dealing with something that's not an emergency, but is very emotionally charged. And patients are not always thinking at their clearest at a time when there's a lot of anxiety, and it's just so helpful to have access to detailed and accurate information when perhaps the patient doesn't remember it or can't recall it easily and quickly.
And when people think public record, they probably instantly think, oh my goodness, there's a privacy issue, but that's not the case with the DHIN.
Absolutely not. You know, anyone who does online banking understands that it is possible to have privacy and security of information that is exchanged across a network. DHIN has the highest standards of privacy and security that are adopted anywhere in the industry for information exchange across a network. We thankfully have never had a breach, and actually electronic records are far more secure than a paper record. There's no way you will ever know how many eyes have looked at a piece of paper. But with the electronic database, we actually have the ability to track and log and audit all of those who access this information. We have roles and security built in so that only physicians can see certain pieces of information based on their role, obviously, and others cannot.
Great. Well, thank you so much for coming in and actually creating some of a bit of an awareness, if you will, of what the Delaware Health Information Network is all about. We thank you.
Thank you so much. My pleasure.
You've just heard from Dr. Jan Lee, who is the Executive Director for DHIN, the Delaware Health Information Network. For Comcast Newsmakers, I'm Elena Russo.